Okay, our last segment on this chapter on operative obstetrics is elective cesarean section. This is a controversial topic. Here's one slide that says, experts warn against elective cesareans. Women are choosing to have potentially dangerous cesarean births far too often, experts said. And yet at the same time, offering cesarean section on demand can be ethical, according to the American College of Obstetricians and Gynecologists. And on a conference that was called to look at this, the conclusion was, honor her choice. Honor her choice. What do you think? Where should we go with this? In March 2006, an NIH consensus conference met for 2 days where they brought experts in, public was allowed to give input, and they looked at all of the data regarding what are the risks of vaginal delivery, of a planned cesarean, of a trial of labor. And when they were all said and done, unfortunately, they said the available information comparing the risks and benefits of cesarean delivery on maternal request versus planned vaginal birth do not provide the basis for a recommendation in either direction, which means individualization. The recommendations are individual counseling for each woman regarding the risks and benefits. Women considering more than 2 children should be aware that a cesarean causes uterine scarring and they should avoid a primary cesarean. And I can tell you from personal experience, women who have their 5th, 6th cesarean, major hazards in terms of blood loss, in terms of hemorrhage, in terms of scar tissue, and anesthesia risk. So if a woman says, I just want 2 babies, I want them both by cesarean, that would be a consideration. But how often do we know prospectively that we're going to stop at 2? The other recommendation was avoid a cesarean prior to 39 weeks because dating of the pregnancy may not be precise and you may end up delivering a premature baby. Individualization is the watchword of the NIH cesarean panel. So make sure the patient is well informed. A lot of the discussion on planned cesarean has to do with the effect of vaginal delivery on the pelvic floor. And that when women have vaginal deliveries, they have a high rate of urinary symptoms, of anal incontinence. And here's an article, does cesarean reduce bladder symptoms later in life? And of course, the challenge here is to look prospectively. 20 years, 30 years, what happens as a woman gets older? An interesting study is done on twins, female twins. One had no children, the other had vaginal delivery, the other one had cesarean delivery, and then comparing the two. And there's a great deal of genetics which is involved here, and it may not be just the delivery. The last word is not yet in, but I think we need to be aware that when you do a cesarean, prior to labor, there is increased respiratory morbidity in the babies. Transendocypnia of the newborn is more common. This article says infant mortality is linked to elective cesareans. Perhaps statistically there is a difference, but when you look at a change from 1% to 1.3%, that's probably not clinically significant. However, even to the fetus, a cesarean is not without its risks. Now, I want you to take this in stride because this does not happen with every cesarean, but this is an example of an iatrogenic fetal injury. Somebody getting a little bit too aggressive with their scalpel cut off the middle finger of the right hand of this newborn. When they looked into the uterus, they found this stump of the finger. They tried to reattach it, didn't work. So, a cesarean, although it is relatively safe, is not without its risks. And that's the end. of elective cesarean section.